Hey everybody, welcome back to another lecture. In this one I'm going to talk to you about patient assessment. So we'll start off with a little introduction. So what is patient assessment and why is patient assessment important? Well, patient assessment is going through and figuring out what's wrong with your patient. Is there something out of whack, something out of place, something that hurts them? What's going on? What's the chief complaint? When did it start? How did it start? And then you put your hands on the patient and you get vital signs and you do a physical exam. Ultimately, patient assessment is important because it guides our treatment. Patient assessment is the most important thing that we can do for our patient, because without a good patient assessment, a good thorough patient assessment, we're liable to miss something, and that can lead to harm to our patients, or certainly not treating them the best way that we can. I want to talk a little bit about the phases of patient care. So the first thing that happens is the patient calls 911, and then somebody answers the phone. And hopefully, I actually believe the patient care starts here, because the dispatchers give pre-arrival instructions. Or PAIs. So the dispatchers will give pre-arrival instructions for conditions like childbirth or severe bleeding. If the patient's in cardiac arrest, they'll provide direction on how to do chest compressions and that sort of stuff. There's a few other things that they can get them to do. They're also going to get some information for us, and they're going to dispatch us with that information. So you may get a 66-year-old female complaining of chest pain. So that's going to be our next step. What is our dispatch information? What do we need to be ready for? Now, realistically, we need to be ready for anything, because even though the patient could say that, she has chest pain, it could be that she has chest pain because she was shot in the chest. So we definitely need to be ready for anything, but it can't hurt to kind of be thinking about, well, what could be wrong with my patient? It gets the brain working anyway. As you approach the scene, you're going to be doing a scene survey, and this is going to be everything from where am I? What part of town am I in? And am I in a wealthy part of town? Am I in a poor part of town? And the only reason we really think about that is that wealthier people do tend to be more on top of healthcare. They go see doctors. They can afford to pay for medications. They tend to be in better health. Poor people, not necessarily. They may not have access to the healthcare system. They may be on Medicaid and not have a doctor that they get to go see regularly. So we want to kind of figure out, where are we? What part of town? And then also, where are we? Are we at an apartment? Are we at a school? Are we at a single family house? Are we at a duplex? What does it look like on the outside? Is the grass mowed? And then the other thing to look for with this scene survey is, how am I going to get my patient out? Do I need any special tools? Do I need to have a stair chair? Is my stretcher going to fit through the door? Do I need to have an elevator to access my patient? This, of course, all ties into things like scene safety, which is, of course, the big one. We want to make sure our scene is going to be safe for us. And when we do this, scene safety is something that you'll mention at the beginning of each assessment, but practically speaking, it's something we do throughout the entire call. Scenes can turn from what seems to be a relatively normal scene where the patients are cooperative to an uncooperative patient, a patient with a weapon, in a split second. So we always have to be on top of our scene safety. We move after our scene survey into the primary survey, which is our ABCs. So anything that's going to be a life threat, we're going to survey for that first. Then we're going to kind of do our history taking in our secondary survey, and this is also your physical exam. And then we're going to reassess. Has anything changed? Did I do any treatments? Did I splint a broken bone? If I splinted a broken bone, did that change the patient's pain level? Did it help, or did it make it worse? Throughout this whole process, there's going to be communication. There'll be communication with dispatch. There'll be communication with our partner, with the patient, and with the hospitals. And of course, with every patient that we take care of, or every call we go on, there's documentation. So why is the order of patient assessment important? Why is it necessary to develop a method of assessment and use that method on all patients? It's because we don't want to miss anything. The order is important, first off, because we want to find life threats first. Because if we miss a life threat, then our patient's going to die. And we don't want that to happen. So we do ABCs, basically our scene safety, and then our ABCs come first. As far as having a method to use on all patients, we don't want to miss anything. If we start jumping around and going out of order, then we'll tend to miss things. Ultimately, each one of us will develop our own assessment process based on what works best for us. However, we all have to have a starting point, so we're going to give you a starting point, and we're going to ask that you use our method to begin with until you really get comfortable with it, and then you can sort of have that take on its own life for you. So we're going to start here with our scene size up. What are the components of scene size up? So the first thing you get is the receipt. The first thing you do is get the call, the location. What is it? And is there anybody injured, or are there injuries, or is the patient sick, like an illness? So this will continue en route. The dispatcher will usually get on and give you further information, and this could either be via a computer, like an MDT, mobile data terminal, or it could be that they come up with the radio and give you some additional information. As you're driving to the scene, is there smoke? Can you look out, a mile and see the plume of smoke that is where your patient is? Is there fire? Are there any wires, like high line wires? Are they still up, or have they come down on the ground? What about railroads? Are you going to have to go across a railroad crossing to get there? And if so, do you have an alternate route? Is there any water? Is there supposed to be water? Is this a big body of water, like a lake or a river? If so, you're going to have to rescue somebody, you're going to want to get some extra help for that. Are you in an industrial setting? The big thing here is safety. Do you know what chemicals are being used in whatever industrial setting you're going into? What are they doing there? And are you going to need any other public safety units, PD, FD, or other EMS, like ALS? There we go. So when you get there, you're going to observe the scene. So you can take a look at this scene. What do you see? Well, you see a vehicle with some damage. That's pretty major looking damage there. So assess the overall scene. What does it look like happened? Where are the victims, and how many are there? Now, sometimes with big scenes like this, you can see they're in kind of an urban setting. You may get bystanders. What do you do with them? A lot of times they'll be standing with the patients because they came over to try and help. So it's really important to identify early your victims. You also want to consider possible mechanisms of injury. And really by mechanisms, we're going to look at this and say, well, this is a head-on collision. I'm going to have concerns for the patient's neck, because with a head-on collision, whiplash is common. I'm also going to look at kind of the knees and the steering wheel. We're going to learn a lot about the mechanism of injury concept. Mechanism of injury, or looking at the mechanism, helps us determine where our patient is most likely to have injuries. We're going to look for hazards. Is there a crowd? Are there any hazardous materials? Did you see one of those, little triangular placards on the side of the truck that had a number in it? If so, we'll teach you exactly what to do with that, but you got to figure out what it is. Are there any electrical hazards? This is kind of interesting here. There's a wire down. Do you guys see this? This wire that came down? We don't know what that is. If that's an electrical wire, we're definitely concerned. Is there any gas? That's both gasoline and, like propane or natural gas. Is anything on fire? On collisions, glass is usually everywhere, as well as jagged metal. How stable is the environment that you're in? If you see that it looks like there's a giant rock that's about to fall on top of you, you should probably move yourself. And if it's safe to grab the patient, then grab the patient too. Is there traffic? I think this is one of the biggest hazards that we see on a regular basis, and we kind of take it for granted. Cars coming at you at high rates of speed, especially like in the night, don't necessarily see you. People are tired, people are drunk, and traffic is a big hazard. The other hazard would be the environment. If you're out maybe in the cold, it doesn't happen often, but we do sometimes get ice storms out here. You'll be dispatched out to a lot of collisions and ice storms. So pay attention to the environment for yourself and for your patient.